Welcome to my physical exam video. I start off by introducing myself, gaining consent from the patient, ensuring they are comfortable, and looking for any signs of acute distress. First, I will assess the patient's blood pressure. I am ensuring that the patient is seated comfortably with their back supported and their arm at their heart level. I am using the appropriate cuff size for the patient. I will locate the brachial artery by palpating just below the elbow crease. Moving on to the arm inspection, I'm looking at the arm size, symmetry, any signs of swelling, the venous pattern, the temperature, the skin texture, and the skin color. Now I will assess the radial pulse. I place my index and middle fingers on the radial artery at the wrist. I am ensuring to feel the pulse for 15 seconds to determine the rate, rhythm, and amplitude. I will also ensure to be grading the pulse. Next, I will assess the brachial pulse. I will place my finger just medial to the biceps tendon to locate the pulse, assessing it for about 15 seconds to determine the rate, rhythm, and amplitude. Next, I will palpate for the epitrochlear lymph nodes. I will palpate 3 centimeters above the medial epicondyle of the humerus, feeling for any enlarged lymph nodes or masses. Moving on to the Allen test. I will be asking the patient to make a fist while including both their ulnar and radial arteries. Then I will ask the patient to slightly open their fist while the arteries are occluded. Next, I will slightly relieve the pressure from the ulnar artery and observe for the return of color to the hand, which should take about 5 to 10 seconds. I will repeat this process with the radial artery. This test assesses for arterial insufficiency. Now I will inspect the legs. I am checking for symmetry, looking for any signs of swelling. I'm also looking at the skin temperature, the skin color, and the skin texture. I'm looking for any distended veins, any signs of hair loss, or any changes in the toenails. I'm also looking at the venous pattern. Next, I will be assessing for edema. I'm comparing the size of both legs to assess the symmetry. Next, I will be pressing down on the medial tibia to check for pitting edema. I will also check on the medial malleosus and the dorsum of the foot. Now I will palpate the superficial inguinal lymph nodes. I'm ensuring to palpate both the horizontal and vertical groups, looking for any palpable masses. Moving on to the femoral pulse, I will palpate inferior to the inguinal ligament, midway between the pubic symphysis and the anterior iliac spine. Next, I will palpate the radial and femoral pulse together to rule out any radial-femoral delay. Now, to assess the popliteal pulse, I will place my hands around the popliteal fossa and press firmly behind the knee to feel the pulse. I will note the rate, rhythm, and amplitude. Moving on to the posterior tibial pulse, I will palpate the artery 2 centimeters below and behind the medial malleoli. I will note the rate, rhythm, and amplitude. Now I will palpate for the pulse on the dorsum of the foot, just lateral to the extensor tendon of the great toe. Next, I will elevate the leg 60 degrees to perform Brugger's test. I will wait 30 to 60 seconds and inspect for any marked pallor. Then I will ask the patient to sit up and dangle their feet off the bed. I am assessing for the time of color return. Normally the color should return within 15 to 10 seconds. Prolonged color return could indicate chronic arterial insufficiency. Now for Trendelenburg's test, I will have the patient supine and elevate the leg up to 90 degrees. I will occlude the great saphenous vein with manual compression for 10 to 15 seconds. I will then ask the patient to stand while keeping the vein occluded. Once the patient is standing, I will watch for venous filling from behind. Usually it takes about 35 seconds for the blood to flow. After I release the compression from the great saphenous vein, I will watch for additional filling. Additional filling indicates incompetent venous valves. Next, I will be mapping out the varicose veins. I will map out a vein on the patient's leg as they're standing and sharply compress the vein. I'm feeling for a pressure wave to transmit to my fingers. Palpable pressure wave indicates two parts of the vein are connected. Now I will be auscultating for bruit. I'm starting at the abdominal aorta 2 inches above the umbilicus. Bruit is a whooshing noise heard during turbulent blood flow. Bruit is normally heard in systole, but if heard in systole and diastole, it could indicate turbulent blood flow due to underlying conditions such as stenosis. After I listen to the abdominal aorta, I will be moving 2 centimeters laterally to the right and left renal arteries. Again, here I am listening for bruit. Then I will go 2 centimeters diagonally from the umbilicus to listen to the right and left iliac arteries for bruit. Then I will move on to the femoral arteries, which are between the anterior superior iliac spine and the pubic symphysis on the right and left side. I am ensuring to palpate the femoral artery before auscultating. Now I will place the bell of my stethoscope on the carotid artery to auscultate for bruit. I'm listening for turbulent blood flow, which is characterized by a whooshing noise heard in systole and diastole. If heard in just systole, this could be a normal finding. I am ensuring to auscultate on both sides. After auscultation, I am palpating both carotid arteries. I am feeling for the amplitude of the pulse and the contour of the pulse. This concludes my peripheral physical exam video. Thank you for watching and have a great day.